You're still in the NSMQ mood, yes. The quiz is over, but we need to appreciate those who made it possible for us to bring it to you live here on the JoyNews channel. Ace Medical Insurance is one of such companies, and Esther Mamli Chato is Corporate Comms Officer for Ace Medical Insurance, and Justice Nanevi is Head of Technical at Ace Medical Insurance. You're welcome. Since we're talking about the NSMQ, let me start by asking you which high school you went to. Oh, Blair B. Yeah, the guys who got the whipping, it was too bad. It was too bad. We had, we had the support here because one of our directors is actually a Blair B.
Oh, but we hope to come back stronger next year.
All the best. And Esther, you went to
Ola Girls. Ola Girls Who?
Ola Girls Who? Yeah. Okay. Oh, you too.
We'll make it next year.
All right. Okay. So let me ask you what Ace Medical Insurance is all about.
Okay. So we are a private health insurance company. We provide medical. We provide medical services to families and organizations, and we also provide third-party administrative services.
Okay. Right. So how does one get onto the insurance scheme?
So with that, you pay a token, we avail to you a policy. And with the policy covers you visiting the hospital, both inpatient and outpatient. That's the kind of visits where you just go and come back. And the ones where you go on admissions or surgeries and all that, it covers medications, the labs, the investigations, all the investigations here. So we avail a particular amount to you. We give you our card. When you visit the facilities, they bring the claims to us and we pay on your behalf. All
right. I know what insurance companies do is to offer different policies because not everybody is within the same economic bracket. What does Ace Medical Insurance offer in that regard?
So it's the same. So for both our the corporate packages, the packages for the organizations, as well as for the families, we have I think five levels of cover, right? So each level with the benefits and then the associated premiums as well. So that depending on the package that you are comfortable with, and then you go for that one.
How are the premiums paid? Monthly, yearly, quarterly?
So typically with insurance, the ideal situation is the annual premium, right, in advance. So one bulk sum in advance because there's an investment component that's also part of insurance. However, we also admit and accept, we appreciate that sometimes the one-time payment at the start is a bit difficult for some clients. So we can agree on some payment terms up to quarterly payment terms, for instance, depending on the amount of the premium we are talking about.
Interesting. When it comes to insurance, people usually shy away because they think insurance companies take a lot of money. So I just want to give you the opportunity to address those concerns. If somebody is watching us and says, hey, I wish I could be on an insurance, but I don't have the money. How much do I need to be on Ace Insurance medical insurance?
So, comparatively, right, when you compare how much you spend on insurance, for instance, to how much you are likely to spend paying for your healthcare out of pocket, you'd realize that generally it's higher the other way around. Insurance, the principle that insurance works with is that we are pulling the small sums together, right, to offer higher benefits to the members. Exactly, when the need arises. So it is rather, when you do the analysis, the long-term analysis, you realize that it is rather cheaper to go for insurance and safer to go for insurance rather than waiting and then keeping money to cater for your healthcare. Essentially, you don't even know how much you are going to spend on the healthcare. So whatever you are keeping, you are not certain it's going to cover for the total healthcare cost. So anyone who is interested in joining the insurance can speak to us. We are ready to make an arrangement for that person, for the families.
Tailor-made,
Exactly, for the families, for the
and
organization.
it's actually less expensive than you think.
Yeah.
Okay.
Get
All
to
right.
us.
I mean, at the end of this, we'll put out the numbers and ways that people can inquire more about Ace Medical Insurance. But your slogan says the new face of healthcare financing. What are you doing differently?
Okay, so for ACE, we are leveraging ICT, right, to make access to healthcare as seamless and convenient as possible to our members. And what we believe in is that in an attempt to get a cure for an illness, right, that attempt shouldn't make you more sick. So you shouldn't go through so much stress to get a cure. You're already sick. So what we do is we have a number of ICT tools, right, that make the whole process very seamless, right from membership onboarding to when you become a member, support services that you get. If you have a complaint, getting it to us and getting it resolved, getting your concerns addressed, right to actually assessing care at a facility. There are tools we have that will enable you to even get health care either in totality, right, or a part of it at the comfort of your office or home. So you can have access to telemedicine on ACE. You have access to what we call pharmacy on wheels. So you can get your prescribed medicines delivered to you as a member at no delivery charge, right, at the comfort of your home or your office. So we are very passionate about this in an attempt to make sure that you get healthcare very, very stress-free.
Wow, that's exciting.
Yeah, we also have an app where our members could go on the app, check the nearest hospitals or facilities they can visit.
That are on ACE medical insurance.
Their utilizations, and even when they don't have their card, there's an electronic card they can.
I love the sound of that.
Yeah.
Yeah, because sometimes it's difficult.
Yeah.
Especially if you travel to a lot of places to keep all your cards, you may leave it in one bag. You know how we go, ladies. Oh, let us another bag. I have an emergency.
Exactly.
I need to visit. And they're like, okay, where's your insurance card? I'm like, I don't have it on me at the moment.
Yeah.
So that's a good one. Quickly, you won the best emerging private health insurance brand at the recent CIIG Awards. So what's the way forward? And should we look forward to seeing you win more of these prizes, obviously with all these innovations?
Yes. We are just beginning, and our plan is to become the recognized healthcare provision company here in Ghana. Yeah, so this is we are just starting. Very soon we'll be there. We are going to win the best brand. Yeah.
Interesting. But quickly though, Justice, tell us why you decided to be part of the NSMQ story this year.
Okay, so as a health insurance company, you'd agree that even though we are not directly involved in the provision of healthcare, right, our activities are pivoted around healthcare. So naturally, anything that we see as promoting the science and maths education in Ghana, we are interested in forming an association with it. And NSMQ, I mean, it's a program that it's making the study of science and maths very interesting. It's making it attractive. Subjects that they are studying hitherto were considered boring, were considered not fun. But now there's a lot of interest in science and maths, and that is partly because of NSMQ. So we feel it's a good brand to be associated with. Plus, it has a wide reach. So associating with NSMQ gives us the opportunity to do something we're already passionate about, that's one, and also get our brand as well out there. So that's basically it.
And that's one of the reasons you're here this morning. Thank you so much for joining us, Justice.
Thank you too for having us.
Esther Mamle Jato is corporate comms at ACE Medical Insurance, and Justice Nanevi is head of technical at ACE Medical Insurance. So quickly, numbers put out, people can reach you.
Okay. Our number is 055-271-275. Also 0556-778-903, 0556-778-906, 0556-778-907. So you can also visit our website, www.acemedinsurance.com. You can send us a mail at info@acemedinsurance.com.
AceMed, MED, insurance.com. All right, we will do that. Okay, quickly, when we return from this short breather, we'll be hearing from another sponsor of our broadcast of the National Science and Maths Quiz, Z&Z Limited Company. Do stay.